The assessment framework provides an outline of the components or the building blocks of an assessment paper. In other words, this is your guide to the content. It is also our way of ensuring that the assessment paper is fit for purpose, we are testing the right things, and that we have consistency between different sittings. There are multiple components to the framework, and some outcomes within the framework are more heavily weighted than others. You can expect more questions on heavily weighted topics than those with lower weightings. For example, there will be more questions based on patients with cardiovascular disease than there will be questions that relate to anaesthesia. The topics provided in each of the outcomes give you guidance as to what to expect in an assessment, but they are not exhaustive, and it is important to think broadly in your preparation. Also remember that what you need to know and apply is not static. Practice changes, and we expect candidates in the assessment to be up to date. For example, you are expected to be aware of the most recent British guideline on the management of asthma, issued in September 2016 by the British Thoracic Society and SIGN. And you are expected to be aware of the guidelines on emergency contraception issued by the Faculty of Sexual and Reproductive Health Care in March 2017. You can expect around 20% of questions in an assessment to relate to paediatric patients. Let's look at one of the outcomes in the framework with a high weighting in some more detail. Instructing patients in the safe and effective use of their medicines, something that is essential in providing patient-centred care. This could include medicines with specific counselling points, for example fentanyl patches, oral antibiotics, oral bisphosphonates. You will need to be aware of when medicines should be taken, for example in relation to food or time of day, how medicines should be taken or used, information that relates to particular formulations or routes of administration, information on recognising danger signs, such as an adverse drug reaction that requires a patient or carer to seek medical advice, for example being aware of the risks and the signs and symptoms of acute kidney injury in a patient taking an ACE inhibitor and non-steroidal anti-inflammatory drug, or a patient taking an oral anticoagulant who shows signs of bleeding, or a patient taking a glucagon-like peptide-1 receptor agonist who's showing signs and symptoms of acute pancreatitis. You will need to know about the what to do when situations, for example when a patient forgets to take a dose of warfarin, or when a patient forgets to take their oral contraceptive pill. You will need to be aware of, understand and be able to interpret commonly held patient information, for example anticoagulant record cards, medicines for children leaflets, insulin passports, peak flow diaries. So when preparing for the registration assessment, you will need to think broadly about each of the outcomes in the assessment framework. Within the assessment framework, the types of calculation questions that you can expect are described. This will help you in preparing for part 1 of the assessment, and you should practice all the different types of calculation in advance of your sitting. Remember that answers must be provided in the units specified in a particular question. Make sure that you are able to convert between different units. Questions in part 2 of the assessment that relate to therapeutics are weighted as shown. This gives you an idea about how many questions you can expect about each of the therapeutic areas. For example, there will be more questions that relate to patients who have endocrine disease than questions relating to patients who have eye disorders. For many of you, this weighting will simply reflect the patient population that you encounter in the pharmacy. In the next slide, I will use infection as an example and describe how you might think about this in relation to preparing for the registration assessment. Infection is one of the therapeutic areas weighted as high. This slide provides you with examples of topics that you should consider within this therapeutic area, but it is not exhaustive. Within infection as a therapeutic area, you are expected to know the mechanism of action of antimicrobials. the appropriate management of common infections, such as urinary tract infections, community-acquired pneumonia, and cellulitis. You will be expected to be able to select appropriate antimicrobials according to patient need. For example, which antibiotics to avoid in a patient who has a penicillin allergy, or how to manage interactions with antimicrobials and concurrent medication in a particular patient. You are expected to know how infection is monitored, and also monitoring that relates to specific antimicrobials, for example aminoglycosides. You are expected to be able to counsel patients on antimicrobials, and you are expected to understand the principles of antibiotic stewardship. In preparing for the registration assessment, you should consider each of the therapeutic areas in the framework and make sure that you know and understand the relevant topics within that area. To help you, let's look at the respiratory system as another example. Again, these topics are examples and are not exhaustive. You will be expected to understand the major diseases of the respiratory system, such as asthma and COPD. You will need to be aware of current clinical guidelines and be able to apply these to individual patients. You will need to understand the mechanism of action of respiratory medicines and the rationale for various combinations. You will need to be able to provide patient-centered care and understand the factors that may affect adherence with respiratory medicines, such as inhaler type. You will need to know about the side effects of respiratory medicines and be able to advise patients on recognizing these and also on how to minimize these. You will be expected to know how patients with respiratory diseases are monitored, including how patients themselves can play a part in monitoring their own conditions. Another component of the framework is the list of high-risk drugs. Given the aim of the registration assessment, it is logical that within the assessment that knowledge and understanding of high-risk drugs, those that we know can lead to patient harm, is tested. There will be at least one question in each sitting that relates to the use of each of these high-risk drugs or groups of drugs, and the next two slides will describe to you how you can use this list to help you in your preparation for the registration assessment. Firstly, insulin, and some of the topics that are relevant. These include an understanding of the disease states being treated, knowledge of the range of insulins and devices available, including the different concentrations of insulin now available, advising on appropriate insulin regimens for a particular patient, which insulins are short-acting and which are longer-acting. Are you able to recognize a regimen that would not be appropriate for a particular patient, perhaps because the wrong insulin has been prescribed? How to monitor the disease states and the effectiveness of therapy? How to use individual insulins, for example in relation to food, or how to store insulins? How to counsel patients about using insulin and what to do in the event of a concurrent illness, in particular information around sick day rules. How to prescribe safely and how to avoid preventable risk to patients, such as by the avoidance of abbreviations. Our second example is anticoagulants. Topics that are relevant include which anticoagulant, both parenteral and oral, is used for which indication, the dose and duration of therapy for different indications, significant interactions between anticoagulants and both prescribed and non-prescription medicines, common side effects, how to recognize these and how to manage them, common errors that have occurred involving anticoagulant medication, including the newer oral anticoagulants, errors such as inappropriate duration of therapy, wrong doses, and inadvertent duplication of therapy, for example continuing aspirin in a patient receiving apixaban, advising a patient on how to use their anticoagulants, and providing suitable patient information. If you have any questions about this or any other aspect of pre-registration pharmacist training, please look in the manual on our website, and if you cannot find the answer you are looking for, then please do contact us.